Good afternoon, everyone. My name is Joelle Abramowitz. I'm an economist at the Institute for Social Research, and I'm excited to welcome you today to this seminar. It's a joint MIDAS seminar series and ICPSR presentation. And I'm also excited to welcome Misty Heggeness, our presenter today. Misty is Principal Economist and Senior Advisor for Evaluations and Experiments at the U.S. Census Bureau. She has a PhD from the University of Minnesota and has worked as a research economist in the U.S. federal government since 2010, and also held positions at the NIH and Department of Labor. She teaches on policy analysis and evaluation at the University of Maryland. Her research focuses on survey response, quality, poverty and inequality, gender, and the high-skilled workforce, and has appeared in a number of outlets. At the Census Bureau, she leads a high-profile initiative to integrate the Census Bureau's major frames and co-leads a 2020 administrative record census project. Today, we're excited to have Misty presenting on estimating the immediate impact of the COVID-19 shock on parental attachment to the labor market and the double bind of mothers. So thank you, Misty, for being here, and I'll let you take it away.
Great, thank you. Let me share my screen. Okay. All right, so I'm very excited to be here today talking with all of you about some recent research that I've been working on, which basically focuses on estimating the impact of COVID-19 on parental labor supply right at the initial stages of the pandemic. So kind of before any of us knew what we were in for. And yes, I work at the US Census Bureau. Because I work at the Census Bureau, let's see if I can move the slide, there we go. It is required that I share with all of you a disclaimer that any and all opinions and any errors are solely mine and do not reflect any official position of the US Census Bureau or of the Federal Reserve Bank of Minneapolis, and I'll tell you why that's relevant in a second. So I want to start this discussion with a broad kind of policy overview of why I conducted this research. And so last year, I took a sabbatical from Census and I went to the Minneapolis Federal Reserve Board of Governors, to the Opportunity and Inclusive Growth Institute. And the Opportunity and Inclusive Growth Institute is a relatively new institute that was started a handful of years ago. And the focus of the institute is to conduct research to better understand and advance the second goal of the Federal Reserve System, which is maximum employment. So the Federal Reserve has these dual mandates, maximum employment and price stability. Most of the Federal Reserve research system focuses on the price stability aspect, but the Opportunity Inclusive Growth Institute focuses on maximum employment. And so this is just off of the website of the Board of Governors, Federal Reserve Board of Governors. And here you can see that they do have a definition that they put up on their website of maximum employment, which is basically the highest level of employment or lowest level of unemployment that the economy can sustain while maintaining stable inflation rate. And so while this definition generally exists for the Federal Reserve, there is a lot of debate and discussion around maximum employment and the definition of maximum employment. So, when we think about full employment or maximum employment, what we want really to consider is that we're really maximizing effort. And so that all able-bodied working age adults who want to work are able to work. And there's a little bit of a question around what does that mean and how do we know when all able-bodied working age adults who want to work are able to work. I'm interested in the labor supply aspects of this in terms of barriers to full employment. So you can think about examples where there's an education or skill mismatch and people cannot find employment. You can think about care responsibilities. So somebody, if you have children, somebody needs to watch them. You know, if you're a grandparent, maybe you are helping out watching grandchildren and instead of working for a paid wage. And then also just elder care is one other area where adults are not able to really engage in full employment because they're taking care of their parents, elder parents. So there's a lot of expectations in society around domestic work and household chores. There's also ways in which employment is impeded through inflexible work schedules. And so for some people who would like to work, doing a 40-hour workday from 8 to 5 every day is not feasible given their other responsibilities at home. And then just all of the cultural norms and expectations around work, and specifically as it relates to different demographic groups. So there's lots of ways in which we can't reach maximum employment because of all of these, from a labor supply side, because of all of these issues that I'm talking about. And for this research, what I'm really going to focus in on is the care responsibilities of caring for your own children. So, you know, the question really more generally, and I'll preface this by saying this is a research paper. It's a COVID-19 research paper, which I never ever really wanted. I was never interested in getting on the COVID-19 research bandwagon, but here I am. But I was more interested in just using that initial shock of COVID as kind of a learning opportunity for us in terms of like what happens. You know, in this case, what happens to parental work when a universally available school system is just shut down, right? And so there's kind of, when you think about this in terms of economic theory, you know, what we would say is like, well, parents will work if they can find a job. So if there's accessibility and if, you know, the opportunity cost makes sense. So the value of what they can get from that job is less than what they would have to pay out in childcare, for example. And the one piece here about universally available school is that once your child reaches the age threshold to enter school, you basically have free care during the work hours. And so if it, you know, used to be too expensive or not, you know, the opportunity cost was too high that you couldn't work while your children were below the age of 6 or, you know, 5 or 6. Once your children reach that age threshold and enter public school, then you're making different choices and you're have more ability and flexibility around work. So the policy question then for this paper is really what happens to parental labor supply in the short run when a safe place to care, you know, for the care and development of your children is unexpectedly taken away. And does that look different in terms of mothers and fathers' labor supply? And so that's the question posed here. So, you know, if we think about how sensitive a parents labor supply to childcare in general, you know, there is quite a bit of literature on this already, most of it focusing on young mothers, you know, almost always focusing on mothers. You know, so there's this literature from the 90s, you know, really talking about how young mothers appear to respond to different economic and demographic changes by altering their labor supply and childcare behavior. And then there was this study in Kentucky showing that, you know, mothers who received childcare support when they were more likely to work, but that the support had little effect on hours worked. And when you go into the 2000s, you know, people continue to study this, and this is a mixed bag of results here at the end of the day. Not all of these samples, you know, this is not necessarily comparing apples to apples. Some of these samples of parents are look a little bit different in each of these studies. But the general idea is that, you know, mothers tend to be sensitive to the cost of childcare and to their own expected wages when they make decisions about work. And so, you know, this, what that means basically is that the availability and accessibility of childcare, you know, has the potential to shift labor supply for moms. And you know, what this study is really doing is looking at that in the extreme. So if you think about early childhood education in the US, it's all basically, you know, privatized, except for, you know, you think about Head Start and other publicly available programs. But for the most part, parents usually have to pay in order for their children to attend and participate. And what we're really doing is looking at a very drastic scenario where, you know, the care for your child is free during the day because they're in school, and then all of a sudden it's not. And so, you know, I'm gonna expect to, you know, hopefully see some shifts going on in labor supply at the onset of the pandemic. So I am really interested in intra-household bargaining and in thinking about how shifting power, the power dynamic within a household, has influence on activities that we engage in outside of the household. So in terms of just thinking about intra-household bargaining, you know, there are studies that have shown that public policy changes that really shift household resources towards women, so giving women more control of household resources, results in higher investments in household public goods. I think about children's clothing, children's education. So, you know, is this just really policy interventions? Like, can we take something like this pandemic, you know, global crisis, and look at whether or not it has shifted or reallocated the dynamics of power within a household? And if these type of kind of global crises or natural disasters shift women's behavior, you know, that also implies that there are ways in which we can implement public policies to adjust behavior in a similar type of fashion, and I'll talk more about that in a bit. Okay, so to set this up, I'm just going to talk a little bit about the data that I'm using, and then I'll talk about the methodology that I'm going to take advantage of here, and then show you some of the results and open it up for discussion. So I am using the current population survey. I'm actually using the IPMized version of this, so the public use available data. The current population survey is administered to about 60,000 individuals annually. I'm going to be using the monthly survey from January through May. And so I'm observing individuals within each month, January through May, and I'm looking at 2019 and 2020. And so the idea here is that with the CPS, you basically have, there's a rotational aspect to the current population survey. And so you can create panels, you can observe people for 4 months in year 1, and then observe them for the same 4 months in year 2. What happens is if you get lucky and get a knock on your door or a phone call to participate in the current population survey, you're in for 4 months, and then you're out for 8 months, and then you're in for 4 months again. And the way that the survey is administered, that first month of your first 4 months will be an in-person interview at your home, and then after that it's through phone. It's over the phone, and the same with the last 4 months that you're in. And so we're going to follow the same individuals over time, both in 2019 and 2020, and observe what happens to them in 2020 compared to 2019. In addition, I'm going to kind of take advantage of the way that the pandemic rolled out to try to create some type of pseudo randomization within the data. And so what I'm going to do is kind of cut states into two categories, either an early closure state or a late closure state. And the way that I'm going to do this is I'm focusing on March of 2020. And the current population survey is administered in the week of every month. It's administered in the week of the 19th. So whatever week the 19th of that month falls on. And it asks, the reference period is the week of the 12th, so the previous week. And so what happened in March of 2020 is that a bunch of states, a handful of states closed early. And by closing, what I mean is that the state government issued stay-at-home orders, and in addition, closed schools. And so schools either took a break, like I live in Maryland, and we had like 1 week of no school, and then the second week kids started virtual school, and we've never gone back. And so what happened is, or how I'm dividing the data here is that states that closed definitively by the 13th of March, which is the week of the 12th, it's the end of the week of the 12th, are in my early closure category. And then states that closed after that, which actually for a handful of the late closure states was that week of the 19th. They closed the week of the 19th or later, or they didn't systematically close at all. There's 1 or 2 states where some local school districts closed, but that the state didn't implement any type of standardized across the state closure. And so it just happens that the timing is very unique because, you know, at the Census Bureau, we went out in field, you know, the week of the 19th and asked people about that following week. And so for some individuals that following week, they didn't have school open and they didn't have anyone to care for their children, whereas the late closure states still did. And so I'm going to take advantage of kind of, this is a very fine, diced cut of the data, totally taking advantage of the way that the CPS is fielded to basically look at doing difference in difference estimation. And so I'm going to compare mothers in early closure states to the same mothers, but in late closure states, and same with fathers, and look at whether or not the parents in the early closure states had different labor market outcomes compared to late closure. So I mentioned I'm going to do a diff estimation for this. And, you know, the first stage is just very bluntly looking at, see if I can figure out how to do the laser thing here. So the first laser pointer, there we go. And so in just a very simple diff and diff, you know, this is the regression that I would, the equation I would focus on. And what I'm interested in is this beta 3, which is the interaction of you were in an early closure state and it was 2020. And so what happened to you compared to the alternative of you. The problem here for this study is that there's a lot of variation among the states that make them not necessarily equal to each other, and that doesn't really matter as long as that variation is consistent. But there are things like industry and other components that, you know, did shift over time that we observe in the data and we would want to control for. And so in the second equation, it's the same diff and diff equation as the first. Again, this beta 3 is the interaction, but I'm going to control for the number of working age adults in the household. This is a dummy variable, 1, 0. Are there any other working age adults in the household or not? I'm going to control for education because it's possible that, you know, somebody acquired additional education from 2019 and 2020. And then I'm also going to control for industry. The idea here being that the industrial composition among states is very different, and then industries were hit very differently with the pandemic. So for example, if you were an essential worker, you know, in a hospital or a grocery store or a liquor store, you know, you remained open. But then other industries like, you know, restaurants, hairdress, nail salons, you know, really a lot of the service industries really just all shut down. You know, construction and roofing industry stayed open, for example. So I just want to take into account that there's going to be noise based on the composition of the industry, and I don't want that to mess up, you know, mess up my results. And then, and this equation too, I'm going to run it just as is, but then I'm also going to subset my sample. So I'm going to run equation 2 just on women and just on men. And the idea here is that women's experience in the labor market is very different than men's. And so, you know, I don't just want to control for gender in the regression, but I actually, you know, want to look at them separately and see what impact it has separately for women compared to men. And then this third equation, I'm just interacting with gender here. And so what this is going to tell me then is this alpha 4 is really going to tell me what's the differential impact on women compared to men. And so that's where I'll look at kind of the differential between men and women. Otherwise, I'm looking just separately, you know, women in early closure states compared to women in late closure states, and vice versa for men. All right, so just some descriptive statistics here by parents and closure status. So this is, I have a panel A that just looks at the total population 16 plus, and then just looks at parents grouped together. But here I'm just showing you what the descriptive statistics look like just for mothers of school-age children and just for fathers of school-age children. And I guess the other thing that I didn't say, but it was in my previous slide, is my sample is going to be, you know, at the end of the day, when I'm looking at mothers and fathers, it's constructed based on mothers of school-age children and fathers of school-age children. So I exclude parents of children under the age of 6, you know, unless they also have school-age children, because I really want to look at that stark difference between having publicly available care for your children all day and then not. So, you know, what I want to kind of focus on here is, you know, I don't want to see much difference or much, you know, too much statistically significant difference for mothers in early closure states, which are these ones, and mothers in late closure states. And I don't. I will say that this line right here, living with at least one other working age adult, these numbers are wrong in what I'm showing you here. I just haven't had a chance to update it yet, but for mothers, it's not 47% in early closure states. It's actually 85.5%, and then here it's 85% for mothers in late closure states. That's the proportion of mothers living with another working age adult. For fathers, that's higher. Again, this number is wrong. The proportion of fathers that live in early closure states living with another working age adult is 94.4%. And then for late closure states, it's 94.6%. So fathers are more likely to live with another working age adult. It doesn't mean that they're working, but they're more likely to be living with another working age adult. And the other caveat that I should mention here that perhaps isn't clear to you up until now, but when this analysis is really focusing on custodial parents. And so I'm only able to observe parents who are living with their children. And I did look at some of the fertility data in one of the CPS fertility panels, and it looks like for mothers, that's really, it's a non-issue. Most mothers live with their children. And so, you know, it's like over 95% of mothers live with all of their school-age children. Fathers, unfortunately, we don't ask men's fertility in surveys, so we don't actually ask how many women have you impregnated to men. So I have no way of knowing, what the extent of the what's going on with non-custodial fathers. What I can tell you is that for the purposes of this research, I really only care about the custodial parents or the parent who's living with the child, because not having a school or a safe place for their child to go during the day, it's not going to impact so much non-custodial parents if the child isn't living with them during the week while they're in school. Anyway, and then educational attainment is, relatively similar among the late and early groups. So I don't see anything here that's giving me a lot of reason for concern in terms of comparing these two groups. I do some robustness checks that I'll talk about afterwards, and just out of an abundance of caution, thinking that, well, these states are really different anyway, and you're not capturing the actual impact of stay-at-home orders and school closures. You're capturing just differences between the states. And so I'll talk about that a little bit more when I talk about the robustness checks. So I have 6 outcome variables of interest. I'm going to look at the extensive margin, the idea that you stay in the labor force, and then the intensive margin, which is really going to focus on the level and the value of your effort. And so on the extensive margin, I'm going to look at, are there shifts in actually just not being in the labor force? Detachment. So you're not working, you're not on leave, you're not looking for work. You just have left the workforce for other reasons. But in this case, one could assume something related to the need to care for your children during the day. I'm going to look at unemployment. So you're not currently working, but you would like to be working, so you're looking for work. And then I'm going to look at, you have a job, but you're not currently not working. And so this is a situation where you're on leave, administrative leave, paid or unpaid leave, whatever it might be. In terms of the intensive margin, I'm going to look at the number of hours you worked. So did anybody reduce their hours that first week of the pandemic when schools closed down and stay-at-home orders went into effect? Was there any shift in hourly wages? I'm going to assume that there is not going to be any shift in hourly wages because, we really make an assumption that wages are exogenous and are not going to change based on somebody's individual labor supply. And then weekly earnings. So weekly earnings could shift, your wage might not, but maybe like if you work less hours, your weekly earnings could shift. All right, and so all of these tables are going to look very similar in nature. And so I'm just gonna take a minute to really, checking the time here, take a minute to really focus on describing for you the first table, and then it'll be iterative in nature. So this first table looks at detachment. So what was the immediate impact of not being in the labor force? And so were there people who detached from the labor force in these very beginning initial stages? And what I'm really focused on here is this is my beta 3, this early closure, you're in an early closure state and it's 2020. This is looking at like the impact of stay-at-home orders and early closure on detachment. And here, this first model is looking at total working age population, ages 16 plus. And then that's also true for this second model, as well as the seventh model. And so the difference between the first and the second model is that in the first model, this is the equation 1 that I showed you. I don't control for anything. I just run a simple diff and diff. The second equation, I do add controls. And so I include, controls for a month, presence of at least one other working age adult, educational attainment, and industry. And so what you see is that when I control for these observable characteristics that I observe in the data that I think change over time, you can see that the significance of being in an early closure state in March of 2020 goes away. And so, and then, if you look at these models 3 and 4, this is looking at all women and all men, again, no significance. And then models 5 and 6 focus on 5 is mothers of school-age children and 6 is fathers of school-age children. And 8 is, again, this 8 is the equation 3 that I showed you where we're doing an interaction. So what's the relative impact on mothers compared to fathers? And so basically what this table is telling you is that in the initial stages of the pandemic, once I control for some of these observable characteristics that I think matter and change over time, we really don't see any immediate detachment from the labor force overall, and then specifically for parents. And this isn't necessarily surprising because none of us knew what we were in for at that time. And so, when I think back to that moment, I was, in Minneapolis on sabbatical, at the Opportunity Inclusive Growth Institute. And my family was still in Maryland, so I'd been flying back and forth every other weekend. And I remember changing my ticket and getting approval so that instead of coming back for the weekend, I would come back and stay here for 1 month. And then, the idea was after a month, all of this crazy COVID mess will be over and we can all get along, go back to our regular line of business. And so, after a month of teleworking from here in Maryland, I would go back to Minneapolis and finish out my visiting scholar position there. And of course that never happened. But at the very beginning, people's expectations, I think, were very different than what they might have today. Okay, so this is table 3 in my paper. This is, again, the setup is exactly the same. So this is equation 1, there's no controls. And then I add controls on the total pop, and then I divide it out by women and men. And then I look at mothers and fathers. And then I interact looking at the differential impact on women compared to men, and the differential impact here of mothers compared to fathers. And this table 3 is the immediate impact on unemployment. Okay, and this is conditional on being in the labor force. So you are looking for work, you are in the labor force, or you're working. And so conditional on being in the labor force, what was the immediate impact on unemployment? And so basically what you see here is that, again, there was really no impact on unemployment initially. And again, we would, that doesn't surprise me because, lots of people thought that this would be a temporary thing, and businesses hadn't started closing down that first week. And even if they did, you've all heard the stories about how it is very difficult and laborsome and time consuming to get to apply for and get unemployment. And so, we know that unemployment went up in a big way, but at the very beginning, we don't see evidence of it impacting individuals that first week or parents and in no differential way. All right, so then we move on to table 4, and this is really where kind of the bang for the buck in my paper comes into play. This is looking at the immediate impact of not working the prior week. Again, conditional on having a job. So these are people who were on leave. And so if you look at, and I'll show you at the end of this talk if there's time, women's engagement with the labor force is extremely seasonal. And so when you look at women's labor force participation, you see big dips in formal work around the time when children are out of school. And you do not see those same dips for men. And so here, this is, people who that week of the 12th took leave. And, this is for, again, one is everybody without any controls, and then everybody with controls, you see that there's still significant increase in the impact of not working. And then when I look at women, when I divide this sample up into women and men, you see that it's that significance is totally driven by women. So there's no significant difference in the, there is this increase here in the coefficient, but it's not statistically significant for men. It is for women, and you see it's much more pronounced here. When I just look at women in the labor market, 31.8% more likely to be taking leave that week compared to women in the late closure states. And then when I reduce it down to mothers of school-age children and fathers of school-age children, these coefficients increase for both compared to the all women and all men. But again, the significance here is purely driven by mothers. And so here it's showing that there was a 68.8% increase in the likelihood of being on leave that prior week for mothers in early closure states compared to mothers in late closure states. And really no significant impact on men, on fathers, I should say. And so that's, a pretty telling story. The way that I think about this is if, there's so much that gets wrapped into gender roles and gender norms. But if you think about it, I know there's lots of parents who say, like mothers who will say, oh, when my kids have dentist appointments or hospital appointments, I'm the one who takes leave to take them to those doctor appointments. When my kids have summer break, I'm the one who takes leave or takes off of work to be with the kids during the day. And you just see that replicated here in this in these results. And so, it's kind of like our knee-jerk reaction. We've come so far in terms of gender equality in the workforce, but our knee-jerk reaction at home is just still so genderized. All right, and so then I also look at, let me just check the time here. Okay, so I also look at hours worked the previous week. And so here, the interesting kind of finding here is that for fathers, I find that they did reduce their amount of hours worked the previous week, conditional on having a job. There was, for mothers who stayed working, there was really no significant impact on their hours worked. But so fathers decreased their time, and there is this significance of differential impact between moms and dads, but it's purely driven by fathers. And so the idea here, so if a father works a 40-hour work week, for example, they basically took less than 1 hour off during that prior week to, for whatever ways in which they were helping out in the home. And that is fathers in early closure states compared to fathers in late closure states. And so kind of the punchline here is that, moms took the week off to handle, children's lack of schooling or a safe place to be during the day, and dads took an hour off of work that week. I looked at hourly wages and really just found nothing, as I expected to. But interestingly enough, I also looked at, the log weekly earnings conditional on having a job, and also found no impact here for parents. And what that basically is kind of suggesting is that a lot of the parents who took leave or reduced their hours worked were, most likely salaried employees, or employees where either they got paid for that leave, it was a paid leave, or they get paid on salary and not by the hour. Okay, so I wanted to do a couple of robustness checks, and then I'll try to wrap it up here so that if there's any questions or any conversation. But so just here, what I'm basically doing is I'm saying, okay, I'm going to take the months of January and February before any of this chaos for the pandemic started, and I'm going to pretend as if the pandemic was in February instead of March, and then I'm going to run the same regressions. And if there were other factors that were significantly different among states that were not attributable to changes related to the pandemic response, I would expect to see significant differences here for these two, which were significant in my prior table 4, and then also these two for mothers and fathers. And I don't see any significant difference, which just provides additional evidence that what I'm seeing is really attached to the structure of the way that the pandemic rolled out, and not something else related to these states in my early closure category compared to states in the late, differences in states with the late closure category. Okay, so I just also did a couple of additional robustness checks here. I ran this regression, which is looking at all women with children under the age of 18, so even the early childhood education, and it's as expected. So it's still significant, but it's muted a little bit. So it's 33% increase in taking leave. Again, that is just speaking specifically to the dynamics of early childhood education and the decision-making process because it's costly. I looked at women age 18 to 24 who don't have any of their own school-age children in the house. And so that's model 4. And this is just thinking like, were their daughters, like college-age daughters who somehow their labor supply was impacted by the pandemic? Maybe they stayed home with their school-age siblings instead of parents. And I don't see any effect there. And then in this 5th one here, I'm looking at grandmothers. So women age 55 to 64 who don't have any of their own school-age children in the house, was there any impact on their labor supply? So were grandmothers picking up the slack for some parents? And I don't see evidence of that as well, at least that first week. I'm gonna skip that for now. Okay, so just to conclude, I really don't see any immediate impact on detachment of the labor market. I didn't expect to necessarily because it was so early. And I also don't see any immediate impact on unemployment. But mothers were more likely to take leave at the onset of the pandemic, and there was really no difference in leave take up for fathers. Fathers reduced their hours slightly in response to the stay-at-home and school closure orders. And then I don't find any changes on hourly or weekly earnings. So mothers and fathers who either took leave or reduced their hours are more likely to be salaried employees taking paid leave. So what does this mean? Just coming back to the original statement at the beginning, thinking about the Fed's goal of maximum employment. This research has gotten quite a bit of traction in the media, actually, which I was pleasantly surprised to see. I did this research study because I was trying to figure out how to maneuver myself into this new pandemic professional life with my children and my spouse and everybody in the house. And so I was agitated enough about this topic that's why I did the research. But doing the research, I found out that I wasn't the only one who was agitated about this topic. So it's like a huge, getting huge coverage in the media. And so, this is really what I think, this quote really sums up what I think about this, but it's like, if you really care about US economic growth, this should be one of the first area of concerns for you. So, this unequal playing field that men and women reside in, that's driven by inequalities in the home, really hinders women's ability to engage in full employment. And if we don't fix that, women are half of our population. And if we don't fix that, we really are kind of kicking economic growth, in the gut. And so that's an area that we really need to be focusing on, and that's an area that the Fed is very focused on in terms of maximizing employment. We need to understand this dynamic, right? And so then it's just really hard to achieve equality. This is what I just said. When you have all these inequalities in the really most private spheres of our life, there's a lot of working mothers who are not able to participate at their maximum potential because of childcare. And this was an issue before the pandemic, but I think what the pandemic has allowed us to, it's really exposed the problem. And, one thing that I have been continuing to say is that if anything good is going to come out of this pandemic, it's really taking action on this issue now, because it has been such an issue for so many mothers. And if we don't, here's another quote where in, I think, an article in New York Times, but, if we don't take action, if we don't figure out how to do more comprehensive systems of support related to childcare, mothers will forever be vulnerable to career scarring during any major crisis like this pandemic. And then just to wrap up, you know, I have been working on research since I did that initial study. I just want to point out here just some descriptive data that I've been working with since kind of more recently. And I want to show an interesting trend. So the gray lines are from 2019. And so you have breadwinner moms, those who earn more than dads, equal pay moms, so moms and dads are the same, supplemental earning moms, so dads earn more than moms here, moms who don't have any earnings, and I'll just focus on that for now. I don't really have time to talk about these other ones, but I'm happy to engage in conversation if somebody's interested. What I want to highlight here is that you have moms who were either earning supplemental earnings or they were making the same as dad. And when the pandemic hit, you see these big shifts in intra-household resource allocation or resources coming into the household. And so you saw moms in these two groups drop significantly, and they went to one of two places. Either they went to have no earnings, big jump here, or they became breadwinners. So, you know, this is a situation where the dad maybe became unemployed. And so, you know, this is an interesting group because in this group, you know, women are earning more than the moms are earning more than the dads. And so there's potential there for some gender inequalities to shift within the households. This group is concerning because these women are, you know, going from having some earnings to having none, and that's really going to minimize their ability to interact dynamically within the house in terms of the power dynamics around resources coming into the home. And so these are things that I just think we need to keep our eye on as we move forward in the pandemic. I think we really need to look at some of the a lot of the gender inequality indicators as we move forward. And then this is just looking at the fall when women started work, or sorry, when students went back to school, a lot of them virtually. You know, this was all over, a lot of media coverage about all the moms who disappeared from the labor market when school started in the fall. And so you see it's approximately 2 million fewer moms of school age kids aged 5 to 17 in 2020 compared to 2019. And this is, the black is September and the gray is October. And so that's, you know, there was in September, there was a 6.2 percentage point decrease in moms in the workforce. Where did they go? A lot of them, you know, took leave, you know, became unemployed or exited the labor market entirely. And so, you know, these are moms, you know, these moms you really need to really be concerned about. And these moms, you know, how long can you take leave before you actually have to quit your job? So that's also of concern. And then most recently, I just broke that out by race and ethnicity and whether or not you had another adult in your household. So these are moms who don't have another working age adult in their household. They're the only one. And then these ones are moms that do have another working age adult in their household. And notably, what you can see is that there's pretty big shifts for Black women. For example, Black women who have another working age adult in their household really shifted downward almost, you know, 10 percentage points in terms of they're at their job and they're actively working. And so these are just, you know, and everybody, you know, has gone down. Black, white, Black households and Hispanic Latina households tend to be more sensitive. Women tend to be more sensitive in terms of work. If they have somebody else who's working age adult in the household, they're a lot less likely to be working themselves compared to white women aren't quite as sensitive to that. And so this is data from December. So this is December of 2020. And 2019 and 2020. 2020 is the orange, 2019 is the blue. And so with that, I'll stop. And then I don't know if you guys do Q&A, or I'm not really sure.
Thanks so much, Misty. That was certainly very interesting, very timely, and valuable to think about for policymaking going forward. So we will open it up for questions. If you have any questions, feel free to put them in the chat, and I can moderate them. Yeah, I'll kick us off with a question that I have. So have you thought about in your regressions to look at, stratifying the sample, maybe to get at, is there any heterogeneity by either, to proxy for like socioeconomic status, like by education level or by occupation or that sort of thing? That
Yeah, so I've definitely thought about that. I think a lot about occupation, because there is a lot of variation based on the type of occupations that people hold. And then there's lots of variation even among mothers, occupation by race, ethnicity, for example. So those are kind of components that I'm trying to incorporate into this new research on the fall that I'm doing. I do think that, the experience is very different in a couple of ways. One is, whether or not you have another working age adult in your household. And so that I do include in my example. But I also think, the where you are on the income distribution, where your household is on the income distribution of households, really also impacts the way in which you've experienced this pandemic and the way in which it's either hindered your ability to work or not work. I think that it would be really interesting to look at women who are in jobs where telework is a viable option compared to women who are not. I think that you're probably going to see big differences there. And so in some sense, one could argue that the pandemic probably wasn't as bad for mothers as it could have been if teleworking wasn't a viable option, because I think there are, quite a few mothers in kind of office focused jobs who were able to shift to telework. That, having said that, big caveat, because I don't think I'm alone in struggling with trying to, get my kids on virtual school and, not come and interrupt me every, break that they have as other moms. And so, even if you're able to telework, some moms are just choosing, I've heard anecdotal stories of, dual learner couples where the mom is like, I can telework and I can keep this job, but forget it. It's driving me crazy because I can't balance that with all of the needs that are going on in my house right now. So I'm just going to quit. They're voluntarily quitting because they don't want to live a life of madness trying to balance two jobs, during the day. I mean, childcare is in and of itself a job. So, yeah.
absolutely. Thank you. We do have one question in the chat from Ed Schneider. Was early versus late related to red versus blue, and would that confound results?
Okay, I'm sorry. I got distracted because I was trying to figure out the screen thing. Can you ask me the question again?
Sure.
I'm trying to find the Q&A here too, then I can see it. But
he asks, was early versus late related to red versus blue, and would that confound the results?
Yeah, so I mean, that's a good question. My response to that is early versus late in some sense was geographically allocated based on how COVID entered the country, right? So we know that in like the coasts, there was a little bit earlier exposure to COVID than in the middle of the country, for example. But my response here is really like, if it's true that it's not really an early versus late or a red versus blue, like there are lots of ways in which one could argue that red states, look different, behave different, act differently from blue states. I would expect that that behavior isn't necessarily going to shift specifically during with the impact of the pandemic hitting us. And so, if it was a if there were differences, red versus blue states, I would expect to see those differences in the robustness check that I did on just using January and February. If there's something else that makes those states look very different, I would expect to see that kind of play itself out in the robustness checks. It's a good question.
If we have any other questions, feel free to put them in the chat. All right, well, Misty, thank you so much for joining us today. It was a pleasure hearing your research. And thank you everyone for attending as well.
Thank you so much. I appreciated the opportunity.